Hey guys, Dr. Sinicropi here. Welcome back to another episode of Recharging the Human Battery Radio. We are an AM 950 as always, and we're gonna jump right in. So, you guys hear us talk a lot on this program about general wellness and biohacking and medicine and all these different topics. But as a spine surgeon, what people ask me, what's the most common thing that I see in the office. And obviously I see all kinds of degenerative things, disc problems and sciatica and all kinds of things. But where I think we really should be having this conversation together is the huge problem of how people are affected by motor vehicle accidents and what kind of care is available for them. What are some of the legal ramifications? It's really, really tough for people that have been in these car crashes or motorcycle crashes or truck crashes or whatever, both physically and psychologically. And a lot of what I see in my clinics are people that have either had more recent injuries of some sort or more distant history of motor vehicle accidents that has affected them to some degree over a long period of time. And it's really changed the trajectory of their life. I can't even begin to tell you how many hundreds and hundreds of stories that I've heard of people that were perfectly, going along with their lives, had never really been in the system seeking care for spinal conditions until they were involved in a motor vehicle accident, which completely sometimes can change the trajectory of your life. Now, we're not even talking about the very severe injuries that can happen with motor vehicle accidents. Obviously, people can have, horrible spinal fractures and paralysis and orthopedic injuries and severe head traumas, things like that. We're talking about the bread and butter. You're at the stop sign and somebody's not paying attention. There's some teenager that's looking at their, cell phone, texting away for some unknown reason. I'm sure it's very important, but for some unknown reason, they're looking at their cell phone while they go through that red light and smash right into the back of your car or the side of your car. And then it completely changes your entire life. So I want to spend this episode really talking about how people should be navigating the medical system, and we'll touch a little bit into the legalese of what I see from my side, where I've testified for so many people that have been injured in these motor vehicle accidents, and really go through the progression of care. And that's going to include conservative management options, the usual stuff, physical therapy, initial pain management, just kind of waiting things out, and then non-conservative treatments, things like acupuncture and light therapy, laser therapy, that basket, into the interventional medicine options, regenerative medicine options. And obviously some people will absolutely require surgery. And I've operated on so many people that have had motor vehicle accidents where all these other things don't work and their quality of life is absolutely miserable, or they have a more, life or limb threatening condition. And then obviously they need surgical intervention. So I'm going to take you through that and share some stories, and we'll talk it through. And my plan is, if you join us back next week, we're going to focus today on the spinal aspect of it, but next week we're going to talk about head traumas and the very real phenomenon of post-concussive syndrome that occurs alongside many people that have whiplash and other injuries to their spine. But that's an entire different and separate topic that deserves an entire episode in and of itself. So we'll see you on the other side of the break. We'll lay it out for you guys, talk it through. We are on AM 950 radio. This is Recharging the Human Battery. I'm Dr. Stefano Sinicropi. We'll see you after the break. Recharging the Human Battery Radio. I'm Dr. Stefano Sinicropi, your friendly orthopedic spine surgeon here from the Twin Cities. We're on AM 950 radio. And today we're going to talk about motor vehicle accidents and how it can impact your lives and really strategies to manage the situation so that you can find the best care possible and get back to doing what you love. And it's a very complicated topic. So we'll try to really dissect out a treatment algorithm strategy. Now, everything you hear on this program is not intended for medical advice. I am more than happy for, as far as motor vehicle accidents and injuries. Come see me at the clinic at Midwest Spine and Brain Institute. Come see me at Hypercharge Health, where we offer so many outside of the box treatment options for people that have been injured in motor vehicle accidents, including concussion management, stem cell therapy, and all kinds of other novel things. But as far as this program is concerned, it's really informational, because I know a lot of people that are listening right now have been themselves impacted, or a family member's been impacted. And again, like we said before, it's changed the trajectory and the course of your lives, and it could be so frustrating to get through the process. So seeking and finding the right providers, the right treatment care is critical, because the longer we sit with you festering in a lot of pain, the more difficult it is to reverse that. And I see it so many times where people have had very delayed care, either blown things off, been put down the wrong pathways, and then they're in even a worse situation. So just to give you an example, we have people in our practice that were high level practicing professionals in whatever they do, and they were fine before their motor vehicle accidents. They have this injury, they get into a chronic pain situation. The next thing you know, they're not able to work. They can potentially get hooked on narcotic medications. They, potentially become people that get so many medications and so many procedures, and they become a totally different person. They don't even remember the life they used to had before. And again, in some situations, it's inevitable, because the damage is too severe, or they have a very severe injury to their head or to their limbs or spine or something like that. But in many cases, if they had gone down the right treatment path, they may have been able to really avoid some of the long-term issues that they've dealt with, both physically and psychologically. So let me reintroduce myself so that you guys really understand why I talk about this with such passion, and really as someone who has seen so much of this in my clinic over my 20-year career. So, I've been practicing at Midwest Spine and Brain now for, I'm pushing year 20. And I've had the privilege of being in an area that really needed more spine care, some out of the box thinking, and it was able to develop a very large practice here in the Twin Cities. And this year I'll hit my 10,000th surgery performed. And it's really been my honor and privilege to serve people in the Twin Cities here and try to restore as many lives as possible back to health. But with having a very busy practice, what's come with that is I've had the opportunity to see thousands and thousands and thousands of patients in my clinic, and so many of them have been impacted by injuries. And unfortunately, although I wish that a lot of these folks had come and seen me, 2 days after their injury, 3 days after their injury, the truth is some people are seeing me 5 years after their injury. And the stories about how bad off they are compared to where they were before the injury are sometimes heartbreaking. And when I go through their algorithm, in other words, where did they go? Where did they enter the system? What treatments were provided to them? Were they treatments that have scientific evidence behind them that really can help them? Was the order of the treatments something that is, that makes sense? Are they people that were stuck in Groundhog Day, or a continuous loop of having the same treatment over and over, despite the fact that it wasn't really necessarily working. So this discussion today comes from seeing thousands of patients and being involved not only in their medical care, but then also getting wrapped up many times into their legal care, and having been asked to testify in so many cases where people have been injured. And that is a whole entire other problem in and of itself. And again, obviously not legal advice. I'm not an attorney. I make this very clear to patients, but there are very challenging legal issues that come up in these cases. And it's something that needs to be spoken about, because honestly, people don't know what to do. They just don't know what to do. So, on that note, let's dive right in. So this problem of motor vehicle accidents, this isn't a small problem. Just here in the state of Minnesota, and this might seem way over the top, in 2023, there were 80,000 crashes. So you might be thinking, I mean, how bad are the drivers here in Minnesota that we have 80,000 crashes? Well, it's not all because drivers are bad or they're texting or they're doing whatever. It's because we also have a lot of bad weather months. And so that adds to the crisis. If you look at the CDC numbers and you look more nationally, that number, it's 2 million. Okay, across the country. So this isn't a problem where we're looking at some rare thing or rare disease. This is something that the odds are that the people that are listening to this conversation themselves have had potentially a motor vehicle accident in the past, but certainly, in the second order or third order, know somebody that's involved in a motor vehicle accident. And it may have, been a minor thing, or it may have completely ruined their entire life. So this is a huge thing. And so when we think about motor vehicle accidents, we oftentimes think about like the most catastrophic, when you're driving on the highway, the thing's backed up and then you drive by and the jaws of life is trying to get people out. And certainly we take care of those patients over at our level 1 trauma center, but that's not really what we're talking about today. We're talking about that fender bender that happens, or that crash that happens at the red light where, people seem like they're okay, or they get transported to the hospital for the while because they're a little bit dazed and confused and are reporting some back and neck pain. But that, where we might think, hey, this is just going to get better and people are going to be fine, that's really not the way it goes. And if you look at the real statistics, about 15%, of people end up with chronic neck pain a year after their motor vehicle accident. That's a huge number. Okay, so you could do, 80,000, even if it was 10%, that's 8,000. And if 15%, that's 12,000 people in the state of Minnesota experiencing neck pain. It's a lot of people. So how are we treating those people? If you look at rear end collisions, about 80% of them have some level of whiplash injury. And interestingly enough, and I tell my and I see this all the time, whiplash we typically associate with the neck, because the neck can whip forward and back, or it's more of a three-dimensional problem. It depends if you get hit from the side where you're affected, or a frontal crash or a side front. But people, I also categorize something else, which is kind of like a whiplash injury of the low back, where that low back pain is also a force is imparted and then goes through the low back. And so you can have a lot of low back pain, which can come with low-grade fractures, injuries to ligaments, things like that, and more severe crashes, but oftentimes can affect the discs, the joint capsules, all the structures, the muscles, both in the neck, the thoracic spine, which is your mid-back, where your ribs are, and in the low back. So these are serious things. And again, I see patients years after their motor vehicle accident. And again, a lot of them have had a lot of treatment, but they don't have a lot of relief of their symptoms. And so that's where I really want to focus what we're talking about today. Okay. So here's how it goes. Okay, so people get involved in a motor vehicle accident, right? Let's just do a scenario, very classic scenario, like I talked about before. Somebody sitting at the stoplight, somebody goes through a red light, they get hit, and yeah, they don't lose consciousness. Maybe they're a little dazed. They have neck and back pain. Okay. They might go to the emergency room or to urgent care. What gets done there? So the first thing they're probably going to do there is they're going to evaluate you, do a trauma series. If depending on how big the accident is, you might get CAT scans of everything. What are CAT scans looking for? Well, on CAT scans, we are looking for any fractures of the spine, things that are missed. And we're very careful, especially if they have other injuries, because you can have distracting injuries. And so people can actually have fractures of their spine and be walking around, not know it. Why? Because they're too busy worrying about their wrist that's fractured. So we call it, and that potentially could risk their spinal cord or their nerves and things like that. So we've got great care pretty much all around when it comes to having that acute injury and you first come in. It's those people, though, that aren't complaining of extreme pain. So in other words, they don't have an acute nerve injury at the moment, and they don't have something that requires all this workup, because frankly, those people get more care and attention. It's those people that come in and they get, they'll get some medications, they'll get some anti-inflammatories, they might get a little bit of narcotic for that one night if they're in a lot of pain, depending on who the emergency room provider is or urgent care doctor is, and then they get sent home. Okay. So those are the people I really want to focus on, because that's where it starts. Okay. So let's call it. So day 0 is the day of the accident. So post accident day 1, you're home, you're sitting there, you don't know what to do. I've talked about this a million times. Okay. I've done posts on this. I talk about it in my upcoming book. Where you enter the system is so critical, potentially, into where you're going to be a year later. Now, what does that mean? I'll make it real simple. Depending on what provider you see at the initial visit, you're going to get potentially very different opinions on what to do next. Okay. And it doesn't mean any of the opinions are wrong, because people are really trying to do their absolute best. It just means it's a very different opinion. So, for example, if you go back to the urgent care room the day after your accident, 2 days after your accident, they're going to look at it one way. If you see a chiropractor, they're going to look at it a different way. If you go see your primary care doctor, who's a family medicine specialist, they might look at it a completely different way. If you decide you want to go right and straight to a spine clinic, they're going to look at it completely different. And so there's so many different ways to enter the system. Now, let's make it even more complex. Not only are there different types of providers that you can enter the system in, but within those groups, right, there's going to be very different management strategies. Dr. X or PA X or chiropractor X or massage therapist X might be very different from their own partner that's in the next door. So we really need to talk about like where this all starts. So it's very basic at the beginning, and then we're going to go on an ascending path of more and more kind of complex interventions. So at the beginning, there's no question that we want to manage the pain. Okay, so things like anti-inflammatories and anything that can reduce the pain is always a good strategy. So typically, doctors, practitioners, whoever, they're going to put you into some sort of, hey, let's help you with your pain, and the less amount of pain medicines you need, the better. So we prefer, things like Tylenol and ibuprofen. Some people need more advanced pain medicine because they really can't function and they've had a significant injury. So something to manage the pain. Motion, moving. This idea about just sitting in bed and resting has been debunked a long time ago. We want to get you within the realm of possibility, get you moving. Okay, these are very basic things. Okay, so physical therapists, massage therapists, getting you into some type of chiropractic care if you're starting somewhere, something to get the body moving, and the blood going is good. So for things like whiplash injury or generalized low back pain at the beginning, unless you're having pain that's radiating into the arms or pain that's radiating into the legs, at this point, you don't necessarily need an MRI scan or something like that, except it's very, very frequently done, especially if you're entering the system at a higher level of care, but you may not necessarily need it at that time. How have I changed my personal treatment algorithms and strategies? Initially, again, all the things I just mentioned would be my initial go-tos. I'm always looking to add other strategies really early on because they can be very helpful and beneficial to patients. One of the things I've talked about a lot on this show, and again, you don't need an MRI for this, you don't need advanced imaging studies, are things like light therapy, but especially laser therapy to the area of pain. Why? Because laser and light therapy can rapidly decrease inflammation in that area. It can increase blood flow and it can help start healing the tissues. People don't talk this way, but light and laser therapy is a form of regenerative medicine, actually, because it helps your own body to regenerate the tissues. It's not often thought that we're always going down the stem cell path when we think regeneration, but without question, light therapy is very regenerative. Okay, just and the chemicals that are released allow your own body's immune surveillance system and other things to work better to start helping in that repair process. So early on, okay, again, not specific medical advice, but something to think of is getting in for some type of movement therapy. So some type of physical therapy or chiropractic management, even massage therapy where you're moving the tissues and increasing blood flow, I think is very helpful, especially very early on. And then getting in as soon as you can for things like class 4 laser therapy, which have excellent studies in the literature showing improvement in reduction in pain throughout for orthopedic conditions and for spinal conditions. And it has become an absolute go-to in my hands. Now there's adjunct care to that. You can do things like oxygen treatments and you do pulsed electromagnetic frequency, but really the go-to in that is laser therapy because it rapidly decreases. And again, I cannot emphasize enough, the quicker we get the inflammation down, the quicker we prevent those secondary cascade. We always talk about this in spinal cord injury. People have a spinal cord injury, and then it's all the secondary stuff that happens that continues to damage the spinal cord. Where guess what? Same stuff happens in a soft tissue injury. So if you have an impact and you have a lot of neck pain and the neck is getting more and more stiff and more inflamed, trying to shut that off as soon as possible, I am telling you that it is critical. It is vital because not only are you stopping it locally, but you're also trying to prevent some of that circuitry from being ingrained in your brain. And because we are wires in a box, the more you start becoming that person, I have pain, it's harder and harder to reverse it over time. And again, that's why it's so unfortunate that I'm seeing these patients so far down the road. So I think as far as initial really conservative management, those are the buckets. I would add other things like acupuncture in there, thinking about doing meditation. And there are actually providers that can help you do guided meditations and things like that. It's very helpful after motor vehicle accidents because often you're not just dealing with the physical pain, but you're also dealing with psychological pain. And if you deal with that earlier, it helps to prevent things like post-traumatic stress disorder and other. And believe it or not, you can develop post-traumatic stress disorder from fairly mild to moderate crashes because all you do is keep replaying when that car hit you, when all of a sudden you realize there's nothing you can do. You can't move. You're stuck. That car is going to hit you, nothing you can do. And that really can lead to a lot of things. So the earlier you get on, and if you're actually struggling with that, the earlier we can get people in for psychological help, whether it be with a clinical therapist, a psychologist, a psychiatrist, if they need that. Once again, I see it constantly, the delay between all those symptoms happening and them getting to those types of providers is the difference between a great recovery and 5 years later, people are completely disabled. I know I'm not trying to simplify it. I'm saying this based on seeing thousands and thousands of patients and listening to these patient stories. Again, all of these things that I mentioned before, please do your own research. Please do your own homework on it. But I will tell you, you will find some convincing evidence, even if you look at the literature on acupuncture. And I just finished filming my first episode on acupuncture with the acupuncturist of the Minnesota Twins, who's amazing. And I'm excited for that to come out. That's another series that I'm doing. It's called The Taste of Your Own Medicine. I got to learn all about Chinese acupuncture and the history behind that, and then the scientific theory in today's, and doing the research on that. Clearly, for chronic pain issues, it's very, very clear. Specifically, though, for whiplash injury, there is good evidence that utilizing acupuncture in that post auto accident, or any type, you can get whiplashes from other things other than auto accidents, but we're talking about auto accidents. Whiplash, really good management tool. So imagine combining things like acupuncture and laser therapy and physical therapy and all these things early, not 3 months later when you're on narcotic medications and are having trouble even getting to work. Early on, the quicker we can get to you, the better. Okay, so now we've talked a little bit about that, and honestly, I could talk about that for another hour because there's more, but I just wanted to hit the more salient points. So now you're not getting better, and there's people that are not getting better. So what does that tell us? If you're not getting better after weeks, and again, if you look at the different studies, again, the one size does not fit all. But if we're treating people with very low level care, I don't want to say low level, but the care, when I say like nothing invasive, you're not getting better. You obviously probably need some type of scanning, because when you're having more advanced workups, for example, by a spine specialist or a sports medicine specialist that subspecializes in spine or things like that, they're going to want more advanced imaging studies to make a diagnosis and really tell you, okay, the therapy and the massage and the laser therapy, all that stuff didn't work. We need to take you to the next level. So once you have your MRI, now we potentially are going to now some people, the MRIs clearly are not going to support going to another level, because they're really at that point, it's continuing more of the same, maybe changing the parameters of how we're treating you, maybe thinking about adding more modalities, maybe adding some ultrasound or adding some shockwave therapy, which I didn't mention before, which has tremendous positive results in some studies. That would be the direction. But let's say you have a herniation, right? You have a disc herniation, or you have severe neck pain or low back pain. What are the options? Well, classically for disc herniations where nerves are being pinched, or if you have pre-existing stenosis and now you have a radiculopathy or pain down the arm or the leg, our go-to is going to be considering something called an epidural injection, where we put steroid medicine next to the affected nerve to try to calm it down. These procedures are done in the millions. In the United States, they can be very effective. They're very safe. Their go-to, it does two things. Not only does it treat, but it also gives us a diagnosis if that particular area might be the spot that is causing your pain. And it really helps the providers or eventually the surgeons make a determination in where to target. So those are epidural injections. There's nerve injections that just go on specific nerves. But one of the things that has very good evidence in the literature is something called radiofrequency neurolysis. Fancy terms. We also use another term, which I hate because it sounds so dramatic, and we say burning of the nerves. And so the interventional pain management specialist can go in there and put numbing medicine on the joints and the ligaments in that area along something called the medial branches in the cervical spine. We also do this for the lumbar spine. The evidence is stronger in the cervical spine, but for some patients, it's excellent in the lumbar spine. And again, having sent out, thousands of patients for these procedures. And so what they'll do is they test it. And if you get more than 80% relief on 2 different occasions with the interventionalist, then they can go in with these little probes. And the way I talk to my patients, I just say these little like microwave probes, and then they send radio frequency, just ways to use lay terms, but radio frequency then burns the little nerves. It actually kills the little nerves, not the nerves that control your function, but the nerve endings that control the pain on those structures. And that can give you relief for many, many months if it works. And that allows then the body to continue to heal and get back to normal while you're having less pain. So, for example, it makes it easier for the therapists and the chiropractors and everybody else to work on you. If you're not at a 9 out of 10 pain, if we reduce your neck pain from a 9 to a 3, obviously you're going to be able to get through a lot more physical regimen than you were if you're in severe pain and you go to the therapist and you're just sitting there, and the second they start moving with you, you're in a lot of pain. Now, one caveat I will say to that is, although radio frequency has strong evidence in the literature, my personal treatment algorithm, and again, talk to your own providers. I'm happy to see you or answer any of your questions on, as a physician, but you have to come see me, is I have decreased the number of people I send for those higher level procedures because the class 4 laser therapy is so effective. In fact, there are many patients that have had radio frequencies with reasonable results that then we sent them for class 4 laser therapy, and they had similar and sometimes better results than class 4 laser therapy in selected patients. And some people it doesn't help either, but it just depends. Everyone is different. But there are a whole host of minimally invasive interventional care type of procedures, all kinds of other injections. Again, there's really good pain management specialists in the Twin Cities. And if you're interested, I would sit down with them and have a consultation and really go through all these options, including things that where they can put needle. The cool thing about these guys, and as a surgeon, we call them needle jockeys, which is good. You want them to be needle jockeys because you don't want them, to be their first time. But these guys that do this all day, every day, the cool thing is they can put those needles, they can get them almost in any space and really specifically target the pain symptoms. And it's really exciting. And so I would urge you to go down that path. But I wanted to talk a little bit about interventional care because people ask me all the time, what are the strategies? All right. So now we have to start thinking, okay, you have the low level care, and you have the alternative options that we talked about some. We have the interventional pain management, which has really benefited so many people, but again, in specific select cases. That doesn't mean everybody should have interventional care. So I don't think that people that don't have the appropriate pathology on MRI scans, or they're doing well with the other, modalities, or they haven't even tried the other modalities, should have interventional pain care, because it just doesn't make sense unless they have a severe problem or severe leg, radiculopathy, nerve pain, and things like that. Again, talk to your providers about those options. All right. In the last bit of time that we have here, the two other really interesting options. Obviously, I'm a surgeon. And so let me skip to the surgical part because it's very easy. The simple way to say it is, our goal as spinal surgeons treating these motor vehicle accidents is to restore function when it's absolutely necessary, restore function, restore mobility. And so in the traumatic setting at a level 1 trauma center, or even at these other traumas, when people come in with very serious injuries, obviously our hands are tied. We have to operate on them because that is what is supported in the literature. That's what we need to do. Not all the time, but many, many people need surgeries. Like if you have a severe fractured dislocation of your spine, it's pushing on your spinal cord, that needs to be fixed with surgical management because you're not stable. If you have a massive disc herniation and you've lost function on one side of your body, that needs to be fixed right away with surgical intervention. And there's so many reasons to, require spine surgery. Now, for the people that have had motor vehicle accident, they're not in that bucket, so they're just more the bread and butter things. After significant conservative options have been exhausted, and again, what I tell my patients is, they come in sometimes and they say, well, I've tried everything, except they've tried, as far as the tools that I have in my toolbox to send them for, they might have tried 2 other things, 2 out of the 6 that are my preferences. So I say, well, you know what? There's these other 4 things. They have good evidence. Why don't we try that? You really haven't tried everything. So surgery, we always try to make it the last option. But for patients that have significant disc herniations, or their arm pain's not getting better, or they're developing weakness, or they're completely disabled, or they've tried all these other things, have had numerous injections and other things, and really cannot get back to work, get back to life, can have no quality of life, that is where surgical options can be of great benefit. And those can range all the way from, bigger surgeries where we have to address a lot of things that have been disrupted and injured, all the way down to very minimally invasive surgery, either through open or endoscopic techniques where we can remove small pieces of disc herniation, which might be sitting underneath a nerve, or open up nerve tunnels, or open up the space where the spinal cord is sitting. And this can make a dramatic impact. Only about, in my estimation, about 5 to 10% of people that have these types of injuries will eventually get down to surgery. But again, we always are going to try to look at these other options before going down the surgical path. What's really exciting is with our minimally invasive technologies, including spine fusions, now that we do minimally invasive, sometimes the downtime is so small from these surgeries that those type of surgeries were quicker to recommend if people are really disabled than bigger surgeries or open surgeries. But again, you really need to have a consultation if you're in that bucket. I'm going to say the same thing, and I want you to take this as a take home. Same thing that I said about surgical options that I said about any options after a motor vehicle accident. If you have a surgical problem or something that the 9 out of 10 spine surgeons would have recommended surgery on if they saw it, and it's all standard of care and all this and that, what we don't want to delay is your path towards getting that spine surgery. I have dedicated the last 2 years or plus of my life now to looking at all of these other options in the alternative medicine space and in the regenerative space and all these other spaces. And it's become a huge part of what I do outside of my spine clinic. But I, as a spine surgeon, will tell you that if you have a severe disabling problem that is a surgical problem, I cannot stress to you how important it is for that to be taken care of earlier rather than later, because developing chronic pain syndromes, developing chronic nerve issues like loss of sensation, or even worse, loss of function, and sitting on that is very detrimental to the patient. And the earlier that we can address that, again, if it's a clear surgical problem, it needs to be addressed earlier. So I implore my colleagues, again, I very much am very supportive of all these other concerns, and they should be in 90 to 95% of the cases, that's how you treat people, and you need to treat them early. But I implore my colleagues to refer them for a spine surgery consultation if people are in disabling pain, because that could be the difference between a permanent disability and them getting back to what they do, what they love to do, their work, their lives, their family. So very, very important. So the final thing that I really want to talk about, and I'm so excited about, and I gave a keynote address recently on this, are regenerative medicine options for patients. That gives us even another tool in the toolbox. I'm going to call these patients the tweeners. And I'll tell you, you know how many tweeners are out there? Millions in the United States, millions. And where are those people? Those are the people that are in that kind of in purgatory, we'll call it. All right. So they're between having had boatloads of treatment that are conservative and then being all the way up to having something more aggressive like a spinal cord stimulator or surgery. And they're in that in between, and they're floating around and they really don't know what to do. Many people don't want to have surgery. Many people are candidates potentially for surgery, but it's not a condition. It's for pain. It's not necessarily because they're going to lose function or something like that. So I am so excited about getting down the path of regenerative treatment options and stem cell therapies. Now, I'll be the first to say, even a couple years ago, I was skeptical about stem cell treatments just because of what I was hearing. But now, having gone very deep down that path with my partner, Dr. Sager, and doing stem cell treatments for people, I can tell you that although we need much bigger studies, the studies that are available that have been done by very reputable institutions show excellent improvements in many patients that have pain, problems with their discs, problems with their joints, problems with spinal ligaments, problems with whiplash, and so on. And this is something that we are seeing in clinical practices where we can take your own stem cells and put them back in your body to help you manage your pain. And this is just another tool to help people get back to life, but that don't necessarily want to go down the surgical path, or that we we want to try to delay their surgery as much as possible. And this goes for injuries to their knees or shoulders and other things, where stem cell therapy through regenerative medicine can make a world of difference. And the data is there and growing daily. Very excited about some upcoming conferences that I'm going to. I have an opportunity to speak coming up as well. And so regenerative medicine options, stem cell treatments are something that if you are listening to and you're in purgatory, something that you should really consider. So on the other side of the break, I'm going to touch a little bit on the legal ramifications of being in a motor vehicle accident, where I kind of come in as a surgeon that may be taking care of you, whether it's surgical or non-surgical. This is AM 950, Recharging the Human Battery Radio. I'm Dr. Sinicropi. We will see you on the other side of the break. All right, we're back. Recharging the Human Battery Radio. Dr. Sinicropi. We are on AM 950 Radio, and we've been talking motor vehicle accidents. Again, the last segment, the name of the game is get into treatment early. Make sure that if the treatments are not working, you don't get stuck in the endless Groundhog Day loop of staying in the same care. We need to continually try to progress your care. Ultimately, we're trying to always avoid surgery, but if surgery is the best answer, it's best to be done early before real severe disability kicks in and the course of your life has changed forever. Regenerative medicine options have given us a tool that can really prevent a lot of people from undergoing surgery. But again, surgery is sometimes necessary. Just the name of the game is, if you remember one thing from this, get care early, get to the right people, and make sure your care is being progressed if you're not getting better. So now, really to touch on, now a lot of you, that's not all you have to think about, right? You got the legal stuff to think about too. And so typically in our state, and it's different in other people where we're in this no fault state, right? So typically your auto insurance will pay up to $20,000 of the bills. Okay, unless they cut you off. Now, there is a big problem with insurers cutting people off, saying, well, this is pre-existing, this is this and that. And that's where it's very frustrating to me, because if you've been injured, you should get the appropriate care and it should be covered. That's why you pay for your auto insurance. So make sure that you get legal representation if you are injured in an auto accident. And again, I'm just telling you this because I have seen people that have waited a long time. They've gone through the system, they're frustrated, and they don't get legal representation until later. And then what happens? They're already in this bad loop of care. They might have exhausted their, upfront monies, or the insurance company might have cut them off after a couple of treatments, depending on where they started their treatment. So it's quite frustrating. So if you think that I'm not involved with this stuff, I'm very involved with this stuff as far as the legal community, because what do they do when they want to litigate these cases? Obviously, they have to get expert testimony from treating providers, and also they get expert testimony from non-treating providers. And so I have spent a lot of my time advocating for patients. And to be honest with you, and again, this is not legal advice, not medical advice, but it is, in my opinion, this is my opinion alone, and I see a lot of this. I believe, as somebody that is taking care of your spinal conditions, it is my duty to make sure that if I'm asked things about your legal situation, that I'm involved in your care and able to provide that. Because when people don't provide that, when providers refuse to be involved in legal cases or say, I don't do that, I just take care of patients, but I'm not involved, it's detrimental to the patients. So I will say, again, there are here and there people that try to game the system, but for the most part, people that have been injured, they're injured and they're injured and they have problems, and they need us to help. So when you're seeking out providers to take care of your spine problems, it's really important to seek out people that are actually going to advocate for you. Obviously, truthfully, and very much, to the standard of what they know and what their understanding of your injury is, but people that will absolutely advocate for you, because that can really hurt you if you don't have that advocate when you are going through your case. Now, the final thing is, again, not legal advice. Be really careful about settling things too early, because if you do have a lot of medical bills that are going to be coming down the road, I've seen people that have made the decision to settle fast, or just basically never get representation and just listen to whatever the insurance company tells you. And then they realize that they are in a world of hurt because their regular insurance might not cover all these bills. They have other things going on. They have lost wages, so on and so forth. So it's very complicated. I could do an entire talk on the legal ramifications for patients when they're injured, but we've run out of time. This has been amazing. This is something I love talking about. If you have a motor vehicle crash and you're suffering, I'm, again, love to see you in the clinic and take care of you as a physician. This is Recharging the Human Battery Radio. We're on AM 950. And this is Dr. Sinicropi, and I will see you next week, where we're going to be talking all about concussions and motor vehicle accidents.